Good morning, ladies and gentlemen. Kalimera. I'm happy to be here in Delphi Economic Forum. I'm a journalist. My name is Vicky Karatzaferi, and I am going to moderate the upcoming discussion, which is entitled Digital Health as a Catalyst for Improving Health Equity. Let me introduce you to our exceptional speakers, starting from the ladies. Professor Effy Vayena, Chair Bioethics, Health Ethics and Policy Lab, Department of Health Sciences and Tech, Zurich. Mr. Cervera, Navas, Director, European Data Protection. Mr. Kostas Saridakis, Founder and CEO, Collaborate Healthcare. And Mr. Dimitris Nikas, Country Managing Director, Medtronic. So, health equity is a major issue since like forever. And I think everybody should agree that a crisis like the pandemic COVID-19 accelerated the uptake of digital healthcare solutions. And all that experience actually showed us that when we have a crisis and an emergency, everybody could work very well, and the governments take fundamental changes in order to help all the citizens, and especially the patients that are suffering from several illnesses. The truth is, though, that digitalization comes with a few, let's say, obstacles. It's not that easy. Of course, it has a lot of benefits aside, because everybody, I think, should agree that it is a powerful force in achieving health equity, so that every single person of us could have access to hospitals and doctors, access to early diagnosis, and access, of course, to therapies. So it's time to listen to our speakers. Please, Mrs. Vayena, you may start your speech.
Thank you very much for the invitation and the opportunity to be here on a topic that I think is crucial. The question of equity is a question that we are dealing with across the board, not only in health, but particularly in health and in digital health. I think we are between the enthusiasm about what digital technology can do, and particularly digital health for us, and we need to also make sure that although there is the potential to improve the issue of equity that we have in all countries, there is also the chance that digital health may exacerbate health inequities in particular. Inequities in general, but health inequities in particular. And I think that is where we have to focus our attention. How can we develop and deploy digital health that improves the situation rather than it exacerbates the problems that we already have? And I would like to focus in the little time I have on three areas that I think are fundamental in this area, finding the right spot. The first problem is, and we know it, that we suffer from something that scholars have called health data poverty. We do not have data of all people. We do not have representative data sets on the basis of which we develop either our diagnostics, our treatments, and very importantly, our digital technologies and digital interventions. And health data poverty means that people who are not represented in the data set do not get the same kind of benefit from the product, be it pharmaceutical, and in particular case, be it the digital. So we really need to make sure that the barriers we have in accessing representative data, health data, are eliminated. And I know that in Europe we have a number of initiatives that are trying to address that very issue, addressing health data poverty. We also have, I think, another issue that is crucial for the progress and advancement of digital health. We have unclarity as to what constitutes evidence that a particular technology in the health space actually works, evidence of effectiveness. What does this mean? We worked for years to establish those kinds of criteria in pharmaceutical development and other areas of medicine. And I think here we're seeing in this space, perhaps because it is a newer space, some unclarity as to what that is. We know we've got thousands of health apps available to people. We don't know how exactly they work. We don't know issues around privacy and data protection. But I dare say that at least in the space of data protection, and at least in the space of the EU, we've made significant progress, regulatory progress as well, and developing a culture around the issue of data protection. So where I'm seeing the unclarity and the need for move is with, of course, making sure that we enforce what we have in data protection in this aspect of identifying and clarifying what evidence means, therefore we can proceed with these various technologies. And the third area that I think is critical is once we establish those, how do we integrate those kinds of digital health technologies in our healthcare systems? Because unless they're integrated and become part of this system, I cannot see how they can actually increase the benefit for all. Now, we had an interesting experience during the pandemic with an app, a digital health technology, the digital contact tracing app that was released in many European countries, where with all good intention and with all privacy issues being considered, at least taken care of to a great extent, we had a problem of integration of this particular tool into the prevention strategy, into the mitigation effort during the pandemic. And I think this can give us a lesson, an important lesson. The technology itself can be good. Technology itself can actually even be privacy preserving, which is a major worry in the digital space. But unless this technology is put in the continuum of care, if it's about care, in the preventive strategy and preventive response, I think we won't see the benefit towards our improving equity. I'm up with my time, I think.
Yes,
thank you very much.
Perfect. Thank you very much. So, Mr. Navas?
First of all, thank you very much for the kind invitation and for the hospitality. Greek hospitality is epic. Thank you so much for inviting me.
Welcome.
A few words about the European Data Protection Supervisor. So we are the data protection authority of the EU institutions. So we act as a typical data protection authority for the processing of personal data by the EU institutions and bodies. And we also advise the EU legislator in all matters related to data protection, which means practically every single piece of legislation being proposed nowadays, because there is always processing of personal data. So we are becoming very, very busy. From the EDPS, we are in the business of human and fundamental rights and in preserving digital well-being for our citizens. We embrace technology enthusiastically. We think that it has huge potential for the benefit of humankind, but we ask our leaders to embrace a new way of digital humanism that puts the individual, the citizen, at the core, at the center of our technological world. So our technologies are more human, and the technologies don't make us less human. Think of the image of the L'Uomo, the Leonardo da Vinci, with the hands in the center of the universe. Let's put this image now in the whole of all big technological companies. The individual is the most important thing, not the machine. Now, coming to the issue of health data and how this is evolving in Europe, and I think Effy cooperates with us frequently. We are big fans of what Effy is doing. Effy put it very nicely in the sense that this is not, data protection is not or should not be considered as an obstacle, but rather as an enabler for digital health to become a reality for all of us. It is self-evident that digitizing health and sharing information has huge potential for humankind, not only to find cure for diseases, but also to help a more evidence-based decision-making by our leaders. But I like to put the example of the aviation sector when we talk about this kind of developments. If we today benefit from thriving aviation sector that is connecting the world, that has transformed the way we live, is because some people at the beginning of the aviation as we know today consider it essential to provide maximum safeguards maximum safety. It is only when people realize that they can go in planes and they wouldn't die that they started to embrace aviation. And this is a good example of the way we should approach digital health and artificial intelligence in general. When people understand that they are not risking their lives or their privacy or their well-being by jumping in these new planes, the whole business will thrive. If we don't do this properly, there will be no business because people will be extremely reluctant to join this way. And as Effy nicely said, the examples with the pandemic are also a good illustration of how contact tracing apps and all these new tools had data protection embedded. And thanks to this, it was possible to have it accepted by the population in general. Otherwise, it would have been a strong pushback. So I better stop here and allow others to speak. Thank you.
Thank you very much, Mr. Navas. Mr. Saridakis, you may start your speech.
Thank you for this opportunity. So I definitely agree with my co-speakers that indeed in digital health we have seen tremendous usage over the last years, but apparently digital health has not yet delivered on the true promise. And let me give you an example. We have thousands of digital health applications at app stores, yet these work in isolation or independently. And the most important thing is that if we really focus on the true metrics of healthcare, we see that big problems like patient non-compliance to treatment or diagnostic errors are still problems largely unaddressed, causing thousands of preventable deaths each year. So we really have to find ways to unlock the true potential of digital health. And the solution here is that these kind of applications must not be deployed on isolation. They must be deployed through ecosystems. Ecosystems will be extremely crucial for the future of healthcare. They have tremendous power. They have already transformed other industries. And it's not by luck that the biggest companies by capitalization like Facebook, Google, and Amazon are built on ecosystems. So the problem in healthcare is that healthcare ecosystems are currently constrained, extremely constrained by regulations internationally and locally, but also by legacy reimbursement reforms and by poor interoperability. So as stakeholders, what we need to do is to try to remove these obstacles, and starting from data, as we said. Data privacy concerns are extremely important, but they must not stand on the way. The goal is to have a healthcare delivery system in which patient information flows seamlessly and securely between digital platforms and ecosystems to support coordinated care pathways and to truly unlock the power of AI. And at the moment, we cannot achieve that due to strict regulatory frameworks like the GDPR. And we have to say that the GDPR is much stricter than the frameworks in the US or in China, where we can see the best example of ecosystems. And at the same time, we have to rethink reimbursement reforms. This is where we lack true innovation. Healthcare does not lack innovation in technology solutions. It lacks innovation in reforms in reimbursement policies. And currently, patients and doctors don't have the incentives to use all these kind of tools. So let me give you two very good examples. One is from Germany, where for the first time, doctors can prescribe digital health applications. This is a fantastic milestone. This is true innovation, what we really need. And another great example comes from the US, where doctors are actually getting a success fee each time a chronic disease patient executes a prescription. So this is the kind of innovation we want to see in healthcare to truly unlock the potential of digital solutions. I know it sounds difficult. It's very difficult to ask for regulatory reforms. But the point, as you said in the beginning, the pandemic proved that it actually can happen. The most important takeaway from the pandemic, it's not Zoom meetings. It's the fact that for the first time, faced with the consequences of COVID-19, the behavior of policymakers, regulators, the government, the hospitals changed overnight. And they have managed to pass groundbreaking reforms that otherwise would have taken years to complete. So we have to really keep that in mind, and with this very same sense of urgency to start building the future of healthcare.
Mr. Saridakis, thank you very much. Mr. Nikas?
First of all, I would like to thank you for the invitation and give me the opportunity to talk in such an important topic. We have from one side regulators, from the other side industry. I'm from the side of industry. It is true that we have a broad scope of digital health now. I mean, like mobile health, health information technology applications, wearable devices, telehealth, telemedicine, personalized medicine. So all these new solutions have many benefits. First of all, give us an holistic view of patient health through access to data and give to patients more control over their health. So I think we have a common ground with regulators. We are talking about patient access. We are talking about improved medical outcomes. I will add two more benefits to that. One is the reducing cost, and the other is making medicine more personalized. With the post-COVID period, we had the adoption of new developments, like increased focus on prevention, well-being of consumers, promotion of multidisciplinary and collaborative health services, supporting value-based healthcare delivery, staffing shortages, and support by digital and artificial intelligence enabled devices and therapies. I think the future is really, for me, looks very bright, but at the same time, we need to have an open discussion how we will shape the future and how we can use all this new technology to improve patient health. I think in the future, we're going to see more technologies to come, like virtual reality, like big data. This is a theme that we need to discuss. Institution needs to have access to patient data and use the data in order to reallocate better their resources. I would like to close this my speech by saying a few examples of how we, as a company, who have already worked on AI and new technologies. One example is our algorithms for atrial fibrillation. So we have gotten an FDA approval from recently about two algorithms that help to enhance the precision and accuracy of heart rhythm data that we get from one device that we have, which is a device that is implanted in a patient. So with this technology, we can reduce the risk of false alerts. And this is very important. And we can help physicians to improve the diagnosis and treatments of abnormal heart rhythms. Mm-hmm. So we see really what is the impact of this new technology onto patients' life. And the other thing is the robotics. The robotics is a new also approach for daily operations in the surgery. Only 3% of total surgeries are done through robotics. With new robotic systems, we can have also the ability, together with the AI, to minimize during the operation to go to wrong areas in the body, or to have problems in the surgeries. I would like to close with that, and okay. I think we have enough time to have a discussion with my co-speakers on this topic.
Thank you all very much. It was very interesting, really. I understand two things. First, that data protection is the huge challenge nowadays. And second, that citizens are the major stakeholders. And Mrs. Vayena, I would like to ask you, are they informed and consulted about digital health since citizens are the major stakeholders?
Well, I think if you, in a democratic state, you could say, well, you know, people are contributing to this, to the dialogue, they are informed through their, and they speak back through their representatives. But I don't think the degree of a public dialogue that's required for those matters is actually sufficient. And I'm not speaking just for Greece. I think everywhere we have a problem there. We assume that people have a certain understanding of the digital. We have not done enough, we're not doing enough to even increase digital literacy for people so they get more involved, they understand what's going on. It took us a long time, as we all in here probably remember, to realize that a free email is not a free email, or a free service online is not a free service online. All of these things take time. So the question, I think, for me is, and where we should become more, invest more in having a dialogue and having more engagement with citizens, not just simply through our representative democracy approach, but rather...
To have an opinion, you mean?
Right, and to understand.
To get informed, to understand, and then have an opinion. And also to understand
what is that matters to them and what bothers them. Mm-hmm. Often we make assumptions about certain things, and we operate on these assumptions that, you know, people or patients care about this, care about that. I think there we need different forms. During the pandemic, we did not have this kind of consultation, but the argument and justification was, we're in the middle of a crisis, in an emergency, mm-hmm. we don't have time for public consultation. But hopefully...
I also think that most people got along quite easily with digital health during the pandemic, because it seemed to be very helpful for them.
It seemed the utility was high, and when the utility
is high... And we got used to GDPR as well. I mean, we were complaining, oh, what is that? But then...
I think that, as I always say, I think that GDPR has an image problem. I think it doesn't have a content so much problem. I think it's perceived as a problem, but I think it has... It's a landmark piece of regulation that I think set a really important standard. So, but sometimes it's perceived as a problem. I'm not in the camp who thinks it's a problem. Every law can be improved, but I think it achieved a lot already, and I think I'm very happy we have it. But back to the citizens, I think this is something that hopefully, if we're not in the middle of a crisis, but ideally we should be able to have these mechanisms during crisis, we need to have this public deliberation, this public consultation about those kinds of matters in a more advanced level than what we're having right now.
Thank you very much. Mr. Navas, is there any chance that the GDPR could be used for research reasons, and is there any regulation about that?
Well, the first thing I would like to say, responding a little bit to what it was said before, is that data protection should not be seen as a challenge or as an obstacle. It's a condition sine qua non. Things cannot be done. It's like if you would say that safety is an obstacle for the uptake of aviation. No. If you don't have safety, you don't have aviation.
So it's the necessary step, you mean?
Absolutely. So if you don't have a strong data protection, you don't have digital health. It's as simple as that. It cannot work without a strong data protection. Now, it is true that we should not overdo it. That there should be reasonable data protection, should be understanding the reality of business and not a dogmatic lecturing data protection. So it's an image issue, as you said. But as Effy said, if you look carefully what it is inside the GDPR about research, it is there very clear that there is a presumption of compatibility for the use of any data sets for research purposes. So this is super helpful for research because you don't need to demonstrate compatibility. It's simply understood that if you're going to use the data for research purposes, it's okay, which is really helpful. Of course, there is a research for the public good, and there is a research for making money, and they are completely different kinds of research. So For the public good, data protection is super easy. Research for making money, for maximizing benefits, for filling in the pockets of some people, there, this is a completely different story. There, it's where data protection may become a problem, because then you have to balance the interest of some people to have more millions in the bank account and the interest of the people to have privacy protected. But if the issue is public good, then obviously public good, innovation, public research outweighs data protection.
Thank you very much. Would
Can
you
I
like to
jump
add
in
something?
just quickly? And I think it was very obvious during the pandemic. For the European Data Protection Officer, but also the privacy regulators, how closely they worked with all those who needed data for that emergency. And I think, I mean, obviously you were in the front lines. This was a very good collaboration, and data access was granted pretty much everywhere. We had an emergency that required a response. So this is possible, and it's doable.
Mr. Saridakis, from a startup point of view, do you have any proposal or any initiative that you would like to see from the governments in order to help the startups move even more quickly?
Yes, exactly. This is very important because we are fighting at the very front line of healthcare with doctors and hospitals, and it is very difficult to establish, productive partnerships that do increase patient outcomes in isolation or independently. So we really need help from public sector people or from companies, big established companies like big pharma or insurance companies, to come and help us start building some very first ecosystems. I'm going to stick on that. I think it's extremely important to deploy the solutions through ecosystems so you can really be in aligned with GDPR and implement it correctly. There is a lack of understanding of the framework from the medical providers themselves. So as a company, we have failed to seal partnerships because a big pharma company was afraid of the GDPR implications, or a hospital didn't really know how to handle a cloud service. So
especially, I think, in the NHS in Greece.
Yeah. This is a huge problem. So
they are suspicious, I think.
Yeah, and they are afraid. It's very important because also the implications, the risks are not really clarified. They don't know what the risk is going to be of non-compliance. So we really need help in this way, that the government or some orchestrator comes and put the groundwork so that these partnerships can really foster. I think this is very, very important.
Thank you very much. Mr. Nikas, a question for you. What should we expect? What are the major trends nowadays in digital health?
We are at the beginning of this journey. And of course, like every beginning, we have to accommodate our journey in a way that we are all protected with GDPR, patients are protected, get the best treatment, and of course, at the same time, to have reimbursement and a framework of how we can operate in that new environment. Very important, because what is coming is really very important. You mentioned before, during the pandemic, we had the opportunity to follow up patients from distance. What we see as a trend is that on-demand healthcare is on the rise. I mean, we don't have any more patients lining up outside the physician's office. We have different schedules, physicians, patients, so we need to accommodate it to the new behaviors. This is the first thing. The other thing is the increasing importance of big data. Big data provides many benefits to health services, like reduces medical errors, or have accurate use of the workforce, and supports also preventive maintenance. For these reasons, many institutions now are doing big investments on how they can use their data. And the third thing is that all these new technologies, like what I mentioned before, AI, artificial intelligence, and virtual reality, is what we expect to see more and more in the coming years.
Okay, so we are in the beginning, as you said.
Yeah.
We are eager to know what's coming next. Mr. Navas, I have another question for you. You mentioned before that European health data space is an example of how all this should be aligned with European values, especially when we have to do with data protection. And you talked about a strong data governance mechanism. So how do you envision this? Mm-hmm. What do you see?
Yes. Let me start by saying that one of the biggest frustrations that we had during the pandemic was seeing how afraid hospitals were of sharing information to fight against the pandemic. And we were repeatedly saying, no, but it's okay. We are in an emergency situation. Do what you have to do to save lives. But still, they were afraid that they would be then accused of not complying with data protection. So indeed, there is an issue there that we need to address. But when you look deep inside, you realize that sometimes it's not a matter of data protection. Sometimes it's a matter of property rights. Hospitals do not want to share these data sets because they are valuable, and therefore they are using data protection excuses, when in fact what they are is protecting their own.
Yes, but what are they doing with this data? I mean, the hospitals, what could they do?
They can make a lot of money with this data that they get from clinical trials.
You know, sell the information, you mean? No, just for their
I mean, these data sets that they have, these hospitals,
yes,
are extremely valuable. They have a huge economic value because they can be then sell or outsource to pharmaceutical companies that can pay
for clinical trials in a way,
or developing new medicines. So this is super valuable. So they say, no, I don't share the data because of data protection. No, I don't share the data because this is my data, and I will sell it to whoever I want. But okay. Going back to the issue of the...
comment, can I, sorry to interrupt you, just to give you an example of this kind of data. For instance, we have a technology that could analyze millions of images from a hospital.
Yes.
And with this analysis, we can have a better diagnosis for a specific disease, like colonoscopy, for instance. Okay? So you understand that this is a treasure of data for everybody. And
it's a gift. Yes.
Sorry to interrupt.
So indeed,
no, it was very useful.
This is exactly what we need, that all hospitals or clinics share all this data and make it available. And this is precisely what we are trying to achieve with the health databases, European data strategy, which is precisely to make it possible. So that all this information...
How many years we have in front of us in order to achieve that?
I think it very much depends the commitment of the stakeholders to the uptake of digital health. If they take it seriously and they don't fight against each other, and they get together and they adopt right code of conducts, policies, and things like that, it will go quick. But if they, of course, if they start fighting each other and looking for their own self-interest, it will take longer. But they should never, really, put the blame on the legislation, because the legislation is enabling this, and this health initiative from the Commission is precisely to make it possible.
Are there any countries in Europe that have achieved to organize this mechanism and make it work?
Well,
not under the European umbrella, I mean each one of it separately.
In general, Nordic countries, and in particular Baltic countries.
It's always about the Nordic countries, I think.
They are quite advanced in general for all kind of, I mean, they have electronic vote, just to make an example, so they vote with their apps nowadays, so just...
And here we don't know how many health apps are there. Do you have any idea, actually, how many health apps?
350,000.
350,000
health apps in the app and Google Store.
And are they free?
The last years, well, it's many. Last year was about 90,000 a year during the pandemic we had, because of course the pandemic created much more.
Gave the opportunity to.
And the spectrum is so wide, from apps that are on the wellness almost side, to apps that could come close to a medical device. It's a huge spectrum, and the majority of this spectrum does not need to meet any standards. There is some of those that they do need to meet certain standards, but a lot of those are just out there.
So how do we know? How are we protected? I mean, it's all about our data, as you said before. So
It's both. I think one is our data, and at least in Europe, they will have to meet certain standards because that's why I think GDPR was such a major milestone. But what do they do is we don't know. They promise you to do something.
Yes.
To lose weight, to drink water, to do this, to do that. All of those things that we see because they have a big market, but there is hardly mental health apps, very, very popular.
Yes.
Millions of people are using all those apps that are on the stores. We have minimal evidence for the majority, or no evidence for the majority of them that they actually do what they say they do. And I'm not saying they're all terrible. Maybe there's some gems in there, but we do not have an ecosystem that either requires those criteria, an ecosystem that actually reimburses when we have a good app, and that would be, that's what we should aim at. But right now, particularly when it comes to the so-called health apps, I think we are quite troubled.
So, Mr. Saridakis, how do you think a citizen should choose the appropriate health app for him?
Well, this is a very important question. First, I would like to stress something that was already raised, that the majority of patients have a low activation level, low health literature. They don't really, are not able to use these tools as they should. So the first thing for me is that, again, the regulators, the policymakers, that drive initiatives that through schools, through public sector structures to make sure that the consumers will have the health literature to be able to start understanding how to use this kind of technologies, how to, to follow up on the instructions of the doctors. So I think the best way is to drive the usage of these applications through medical providers or through authorized bodies and not direct to consumer, because there is a lot of misuse with this, in this way.
Mr. Nikas, because you have the experience from Medtronic, I would like to ask you and close our discussion with that. Do you think that it's easier for the patients to adapt digital health when they have a serious problem, health problem, and they have the, the brand name of a great pharmaceutical company? Does it give them the safety to adapt the new habit?
I will answer to you by referring to the last comment.
Yes.
And also to what my co-speaker already mentioned about the huge number of applications. Okay, we have we have a huge number of apps, but maybe a short number of solutions, or a short number of what we call medical devices that they have been already approved through clinical trials, through the body, the respected body, get either FDA or CE approval. So when we have this kind of solution through a digital either an application on the phone or an algorithm on a device, which is the same, it's both digital. In such a case, this has been already gone through different processes in order to get approval. So the patients should be like they were a pacemaker. It is the same thing. They have to trust this device because it is also suggested by their physicians. Get it?
So, thank you all very much. I think that we made progress in understanding this difficult subject, and the optimist scenario is that we are going to have a European data umbrella under certain legislations, and that we are going to be protective, and I hope more healthy. So thank you all very much. Thank you, ladies and gentlemen, for attending us.